Now that the OASIS has been completed, we move on to the creation of the 485, also known as the Plan of Treatment or Plan of Care. If you notice here, it says Plan of Care, not entered. I will then select New, select Plan of Care to enter in the information. We suggest the OASIS be entered prior to creating the 485. The reason being is because if users are utilizing the OASIS Answers template, the orders and goals can be populated based on OASIS responses. If the user clicks Yes, the program will load any existing template created, and if No is selected, users will just continue working with the 485. If you do not have any templates set up and you click on Yes, what the program does is it makes sure that you do have any OASIS templates existing for orders within these selected answers. And it also does a check for the goals template as well. I will briefly go over the setup of the OASIS Answer template, but these will be covered later on in a further lesson. Under Administration, you can select Plan of Care Defaults and select OASIS Answers. Here is where users can specify orders and goals for each response to any of the OASIS questions. For example, if users have specific orders and goals, depending on the discipline, they can highlight which discipline and what the response they want the orders and goals to be placed under. Again, this is manually typed in, and the program doesn't have any default setup in regards to this template. Now within the 485, you can state whether the status is draft or final, meaning you are either currently working on the 485 or it is ready to be printed and sent to the physician. The 485 can also be tracked by populating the date sent and date received, while also indicating whether or not the physician or case administrator has signed the care plan by marking the checkboxes. Users would then continue to enter in other narratives such as supplies, allergies, safety measures which were already set up in my agency setup under the Narratives tab along with my orders. They can continue to set up their goals, nutrition, 47 or other additional narratives, the medications, which can be typed in by freehand or can be selected from a drop-down list which is also linked to your medication library. The Limitations tab allows users to select functional limitations, activities permitted, mental status, and prognosis. The only requirement is to enter in the prognosis. Everything else is optional. If you noticed earlier, one of my diagnosis codes in my 485 was red. If I try to save this assessment with a red or invalid diagnosis code, the program will let me know that the following diagnosis codes are expired. You can click OK to continue or cancel to edit. The way that the software determines whether or not a diagnosis code is expired is through the library. The effective to date must not be before the certification period dates. And if it is before, it will show up in red and be shown as inactive or no longer valid. From here, you may have to change the code and update it with a brand new one. To view and print the 485 form, make sure that Print Preview is selected, and under the status record, select Print, Plan of Care. Users can choose to print a 485 for the provider, physician, or intermediary by selecting the desired report copy. The only difference between the forms is whether it states provider, physician, or intermediary on the bottom of the form. If draft is written on the preview, edit the 485 and change the status to final.